Hi, my name is Joao Cavalcante. I'm from Cleveland Clinic, and I'm reporting here as part of the FITs on the Go blog. And I'm here with Dr. Daniel Lee from Northwestern University in Chicago. And Dan, I would like to ask you, Dan was presiding the session here entitled Some Advancements in Coronary Artery Disease Using Cardiac MRI. I'd like to hear from you, Dan. What did you think was interesting presented this morning?
Well, we had a lot of really interesting abstracts in this session, ranging from different applications of viability or infarct imaging through applications of perfusion imaging. I think one of the more interesting abstracts was an abstract from Cleveland Clinic. It's entitled Infarct Heterogeneity is an independent and incremental predictor of mortality in patients with severe ischemic cardiomyopathy. They took a very large cohort of patients, about 450 patients with ischemic cardiomyopathy, and quantified different imaging parameters, including infarct size and infarct heterogeneity, by using different signal thresholds to define core and peri-infarct zone. One positive aspect of having such a large high-risk cohort is that they had 186 deaths, which really gave them the statistical power to look at a number of variables. And they were able to find that among the variables, the predictors of survival were end-systolic volume, total scar, and infarct heterogeneity, with infarct heterogeneity having the strongest hazard ratio. And I think that this is concordant with what we expect, that worse remodeling of the ventricle and higher scar burden would predispose patients to an increased mortality, particularly from arrhythmic events. Some other data they presented showed that in a subset of patients who had ICD shocks, that the infarct heterogeneity predicted that. I think the power of this particular abstract is that in these patients, who most of whom would already qualify for an ICD, the difficulty is that we know the number needed to treat is high, and many patients receive ICDs but never receive appropriate shocks, and perhaps using different parameters and coming up with some sort of a point scoring scale, we may be able to better select patients. We may be able to identify those patients who may satisfy an EF cutoff, which is our current simplistic way of selecting patients for ICD. We may be able to better risk stratify patients, identify those who might not need an ICD, and so we can be more selective with our therapies.
Terrific. I think that's a great summary, trying to use this MRI-based scoring system to predict who would truly benefit from this costly device therapy. I would like to thank you, Dan, very much. I'm here at ACC 2012. My name is Dr. Joao Cavalcante from Cleveland Clinic, and I'm here reporting as part of the FITs on the Go blog with Dr. Daniel Lee from Northwestern University. Pleasure to have you here, Dan.
Oh, it's a pleasure to be with you.
I'd like to ask you here for the Fellows in Training on the Go blog some advices of your that you had starting a career in academics. What things would be important to look out for in the first few years and to establish yourself and your research pathway?
Well, certainly it's a bit cliche, but I don't think it can be overstated that having a good mentor is really key. There's a lot of decisions that one needs to make in those first few years about how you allocate your time, which projects you're going to pursue, and also in terms of getting your name out there and getting to know other people in the field. And that's where a strong mentor who has your interests in mind is really critical and can really help you navigate those first few years, which are so critical.
Terrific. Well, I think that's a great advice, and looking forward to other opportunities as well for others to contribute here with the FITs on the Go blog. Thank you.